Hello friends, good evening once again, and happy to see you back to blueprinting in assessment, right? It is a very important topic. We'll not be discussing too much about the theoretical aspect, but after some important discussion, Dr. Kishore is already there. I think, can you hear me? Hello?
Yes, Kishore is there.
Yeah, he's asking for the link.
Kishore is already there. I can unmute him.
Dr. Kishore?
I'll send the link also.
Okay. We can start with blueprinting in assessment. Right. So, what is blueprinting? We can start with a beautiful example of that. Right? You must have heard a story of Alice in Wonderland. There was a very interesting incident in which Alice, while walking, comes to a bifurcation of a road, and there was a cat which was sitting on a tree. So she was confused, and she asked the cat that, will you please help me which way I'm supposed to go? So would you tell me please which way I ought to go from here? The cat says, that depends a good deal on where you want to get to. The answer from the allies, I don't much care where. And then the last point is very important. The cat says, then it does not matter which way you go, right? So if you're not sure about where you want to reach, then it is not important to know the way, right? Whatever way you walk, you are ultimately going to reach. That is very similar to our blueprint in assessment, right? This word, you must keep it in your mind. That is magic triangle, right? The magic triangle, over here, you see there are three important points: the assessment, objectives, and instruction. So you can see over here, these three should be linked properly. What is your objective? It should be tested in assessment, and what is being assessed should have been taught. And you should teach all those things which is being there in your objectives, right? Unless there is a synchronization in this three aspect of the triangle, it is going to be very difficult, right? So the dog over here in this funny picture is dancing with the help of a tail. Rather, tail is controlling, right? Tail is controlling the dog. So it has been said that assessment is the tail that wakes the curriculum dog. Whatever we do, whatever objectives we prepare, whatever teaching learning method we adopt, ultimately student is going to learn what is going to be asked in examination, right? So ultimately everything is centered around the assessment. So it is very important portion of a magic triangle that what you are planning for assessment is going to be implemented in your institution, right? Which type of question you are going to ask, which type of method you are going to adapt, ultimately the student would learn that. So simply don't allow that dog to dance on the tail, rather you make the tail very systematic, and so your whole syllabus would become synchronized. Many times after taking this examination, we find that students are many a times surprised. And when you take such type of feedback, then you will find such type of answers also. Too lengthy paper, questions from few systems only, questions too vague, too long. Long questions were bouncers. We have not been taught about this. Or sometimes too easy, damn, I wasted my whole time in reading the smaller things. So, what is blueprinting? If you want to avoid that, blueprinting is very important. By the word, the blueprint means detailed plan of action. What you want to build, you have a plan. If you don't have a plan, you will come up with anything like allies. If you don't have a plan, you will end up anywhere but except your desired place. So blueprinting is very important. It is a map and a specification, right? It is a map and a specification for an assessment program that ensures that all aspects of curriculum and educational domains are covered by assessment programs over a specified period of time. So two important things over here, if you once again pay attention, that all aspects of curriculum and second educational domains are covered in assessment, right? So fundamentally, assessment should be linked to the objectives, and in case of competency based medical education, it should be linked to competencies, right? Now, what is the need of blueprinting? The blueprinting will lead to clear and transparent assessment, and naturally it will lead to learning, right? Student would learn the question which you feel is very important, and if you ask in examination, student would learn that. The blueprinting will synchronize the mode of assessment, the competency, and the teaching learning method. So suppose you feel that competency of a Gram-Stain is very important for undergraduate medical student, right? You teach them by the DOP method and ask in practical examination to perform Gram-staining, right? Simply asking a long question in theory paper of grams about Gram-staining is of no relevance, right? It is not going to lead to any type of learning, right? Student would read the Gram-staining and student would not attend your practical of Gram-stain. Second thing, when we put it over blueprinting, we'll find we have to emphasize the higher cognitive skills. If you simply study your question papers of university for last few years, if it is not specified by university, you will find most of the questions will be of a lower recall, memory, or knowledge level only, according to Bloom's taxonomy. And one most important thing is fair sampling. Unless you prepare a blueprinting, you are going to ask questions from few important topics only. Many of the topics are being left out. So fair sampling is also being ensured with the help of blueprinting. Now, there are two important threats to the validity in examination which you must remember. We all must remember the two important things. These are the scientific aspect, but if you simply read this, you will be able to understand what is the common meaning for that, right? One is construct under representation, CU. Now, this refers to undersampling or bias sampling of content. Usually this happens when we don't give weightage to important topics, the topics which are of importance of national health. Such type of topics are not being represented. That is number one. And second thing is construct irrelevance variance, CIV. Now, what is that? This is also a systemic error which is being introduced while we prepare assessment. Usually, the teachers or examiners has a tendency to take certain favorite topic or hot topic or trivial topics, or there are certain errors in construction, right? So two important things which are being inserted into assessment are CU and CIV. Both can be corrected. The construct under representation with the help of blueprinting, and CIV, that is the help with validation. Over here, we must ensure that examination is not that the question paper is set by only one examiner and he does not allow anyone to look into that, right? It is good that few senior examiners sit together, draw a question paper, and then there occurs a validation, right? There would be some change, modification, because everybody should feel the same as far as the question paper or theory examination is, how it is being created and administered. So now, with a brief introduction of a theoretical aspect, we'll go for preparation of a blueprint, microbiological aspect or the subject aspect. The important point, the first of all, when we prepare the blueprint, first we need to define what is the scope and purpose, whether it is a formative or a summative or internal examination. Usually formative assessment, blueprinting is very difficult, right? Because this is happening along with the teaching and learning. But for internal and summative, it would be easy, especially if you start preparing the blueprinting for internal assessment. At the end, you will be able to prepare the blueprint for the whole summative examination. Second thing, the domain and level. Which domain you are going to test, whether it is knowledge, skill, or attitude. And what is the level, the competency level, that is know, knows how, shows how, and performance, right? Then types of question which you are going to ask in examination. I'm just taking an example of a theory, as for example, knowledge. Then it is LAQ, that is long answer question, short note, short answer question, or objective question, or MCQ. Then content weightage has to be determined, that is impact multiplied by frequency. We'll come to that point. Then core. In competency-based medical education, it has been very well defined. What is must know area, what is desirable to know area, and what is nice to know area. It has been reduced to two parts, core or non-core. You can do that also. And the level, Bloom's level, which you are going to test, that is knowledge, understanding, and application. Actually, Bloom's has got 7 levels, but it's very difficult to differentiate into that. If you can target 3 levels, then it is sufficient, right? Knowledge, understanding, and application. So one thing which I was talking about was weightage. So in case of a clinical science, weightage, that is impact multiplied by frequency. So what is impact? Suppose there is one disease, malaria, then how important that topic to the health outcome, right? Relevance, what is that? That may be a non-urgent, semi-urgent, or urgent, or critical, semi-critical, non-critical, like that. So if that means non-urgent means it is not life-threatening. This may be a, but it is urgent but not life-threatening, or it can be a serious and life-threatening. So clinical importance, depending on health outcome, can be classified, and point is assigned 1, 2, and 3. And frequency of that particular disease which is occurring in the community. It may be rare, it may be moderate, or it can be very common. So that is how we can identify the weightage for clinical sciences. But for basic sciences, it becomes very difficult. So we have to relate with the clinical. So clinical correlation, and you have to identify whether it is minimum, medium, or most. According to that, you can classify. Okay, so over here, now we are going to the application of blueprinting in microbiology, right? We are going to set a question paper for second MBBS microbiology, first internal theory examination, right? So content for this examination, rather syllabus for this examination would be general microbiology and immunology, right? We all know that. Next thing, what would be the type of question paper setup? We are going to ask long question. Suppose this is a percentage roughly distributed 20%, short note 40%, short answer question 20%, and MCQ 20%. This question paper may be of 50 marks or it may be of 100 marks, right? Or it may be a 50-50, 50 from general microbiology, 50 from immunology. But this would be the weightage. Then we need to decide the weightage, impact by frequency. We'll see to that. Then before we administer this examination, at least a week before, all senior teachers need to sit together and need to identify the core and non-core area and can be classified into must know, desirable to know, and nice to know. It can be modified into core and non-core, 80% core and 20% non-core also. Or if you want to do like this, you can identify must know 70%, desirable to know 20%, nice to know 10%. Suppose laboratory diagnosis of gonorrhea, it should be must know area. But the culture characters of gonococci on culture media may come into desirable to know or nice to know area, right? Like that. Like culture characters of anaerobic organisms would definitely come into nice to know area, right? It is all right. This you can classify among yourself, taking the help of the experts. The most important part is you need to identify and fix what you are going to ask. Knowledge 50%, understanding 40%, application 10%. This is variable. Usually, if you see in first phase of MBBS, the knowledge is usually 50%, understanding is 25%, application is 25%. Second MBBS, knowledge would be 25%, understanding would be 50%, application would be 25%. Third year, it may be like knowledge 25, understanding 25, application 50%, right? Such type of division may be recommended. So that depends upon the college, individual college, and university, right? So according to that, if it is not there, the experts within the department can decide such type of distribution. So once this is ready, I'll show you one Excel sheet, and over here, right? Okay, are you able to see the Excel sheet? Dr. Sarwat Fatima, if you can unmute yourself.
Yeah.
Okay, thank you, madam. Right. Okay, see, this is the sheet which was prepared by our department. All experts we set together and devise that, right? This is for general microbiology. I'm going to show you two sheets. Now, portion of that you can see over here. We are going to ask 10 questions, that is MCQ, 6 questions, that is SAQ, 6 short note, and 1 LAQ. Although this portion of general microbiology is of 50 marks, but because of option, it will come to more than 50, right? Next thing, you define, rather we have to identify the topics, right? See, the blueprinting, when you prepare, it can be of 1 dimension, it can be of 2 dimension, it can be of 3 dimension. I'll show it to you in this particular thing. Over here, you can see the history of microbiology, taxonomy, microscopy. These are the topics of our general microbiology, right? And this is the rating. Rather than 1, 2, and 3, we set together and we differentiate into the rating, that is maximum 5, right? So history of microbiology, we thought we give 3 marks, taxonomy 1 mark, rather rating 1, microscopy 3, like that. So this is which was decided by discussion among the teachers. So this is the total number of the rating. Now, general microbiology portion or section, the total mark would be 62, right? It would be 62. So how much mark, ideal mark weightage would go to each topic, that is being calculated by this Excel formula, right? So this is out of 30 and now this is out of 62. So once that is decided, what you do next is this one, right? You have already decided. Must know 70%, desirable to know 20%, nice to know 10%. Once again, I say that this is variable, right? You can decide and you can change. Then knowledge 50%, understanding 40%, application 10%. Once again, this is variable according to what you feel. So once that is decided, now you move on to this side, right? Simply, this can be prepared by the Excel, right? You can see this topic over here. This is one dimension, so I'm taking topic over here. And on other dimension, you can see there are several other things which are being put over here, right? So these are the dimension. Which second dimension we are talking about the core syllabus and the Bloom's level, right? So each topic you can see must know, desirable to know, and nice to know, right? And on other hand, you can see the question MCQ, SAQ, short note, LAQ. And in each one, you can see it is knowledge, understanding, and application, right? So this is how you start planning. Okay, so now we are moving to the same type of sheet, but this is immunology. Right? In immunology, you can see over here, this is also prepared very similarly. The topics are like this, right? You can see over here, introduction, structure, function, antigen, antibody, these all things are there. That is already being given in the standard textbook, and these are being rated. So out of this total 43, these are the rating of individual topic. So this is ideal weightage from 62 marks. This is what we decided, right? Okay, once it is decided, we already decided this one, MCQ, SAQ, short note, and long answer question. Must know, desirable to know, and nice to know. Cognition, knowledge, understanding, and application, right? Now, this is 45 and 5, a slight variation over here. Okay, so once this is ready, now you move on to this part. When we prepare question paper, it is very important that you start with the long question, right? Over here, you can see the first long question which is being prepared is this one, right? So remember, this was taken from the topic structure and function, right? When you prepare a long question, when you ask a long question, please see that it should be from must know area, right? So the long question taken from this topic, one part of the long question, as we know, this long question can be structured, right? So we have divided into two portions, 6 plus 4. So this long question is divided into two portions. One is must know area, second is desirable to know area. It is from structure and function of immune system, and this is from long question, long answer question, right? Okay. So once that is decided, you will find that usually in one section of immunology, you will only have one long question, right? Then you move to short note, right? Now you identify important topics, right? According to the weightage which you are giving. And you ask question from, as for example, one short note is taken from antibody. And this is simple recall, right? There is one question which is asked from cell-mediated immune response, and it is of understanding, right? Likewise, you take out all short notes, right? So remember that when you take this, you go from higher mark to lower mark. Then third, you go to short questions. Remember, short questions and MCQ, it's easy to go to higher level of Bloom's taxonomy, that is understanding and application, right? So I've taken out. Now you will be able to know from this total number which is coming up over here that you have to take out the topic from which questions are not being asked, right? So short questions asked from humoral response, CMI, like that. So once that 10 questions are over, last you move to MCQ, right? And when you move to MCQ, you also have a look at this particular table, right? If you prepare this table and put your formula, you will be able to identify these questions which you put will come up over here. I will share this table with you in Google Classroom. You can use it and you can modify it according to the way you want to use it, right? This question would come up over here. You can see the ideal weightage and this is the assign. The moment you put these questions over here, this will ask you or it will indicate you, right? You can see the knowledge you have assigned 52%, ideal is 50%. Understanding is 45%, you are asking 41. Application 5%, you are asking this much. Must know area 70% is indicated, you are asking 69%. Desirable 22%. Nice to know area 8%. It is very difficult to match this 100, the 70, 20 and 10% exactly, right? So nearby is all right, no problem. So this is how, and if you feel that this particular question, you need to shift from knowledge to understanding and from understanding to application, you can move that. So once this sheet is ready, now you are ready to prepare your individual question. That is the last. So once again, we move to that part. Long question, right? Define primary and secondary lymphoid organ, describe immune structure and function of thymus, explain development of T lymphocyte. Over here you can see define and describe primary secondary lymphoid organ and simply describing the structure and function. You can consider as a simple recall knowledge, right? But explain development of T lymphocyte requires some understanding. So that 4 mark you can put it in understanding, 6 marks you put it in recall, right? So that is what I was talking about. And you see this is the core area, right? Understanding structure and function of immune system is core area. So you have taken this question from core area and 6 marks for knowledge and 4 marks for understanding. Likewise, short note, you can see another area taken, that is antibody, simply asking IgA, structure and function, recall, right? Another question, role of macrophage in antigen presentation. Over here you can see this is not simple recall. All texts which are red in color are recall, green in color are understanding. So role of macrophage in antigen presentation requires bit of comprehension, right? So that is how you prepare that. Then you move to short question. I'm just giving few examples only for better understanding. Short question. What is selective media? Give 2 examples. Many frequently as a teacher, these are the easiest question to frame, right? So we usually prepare such type of questions. So simple recall only, but these questions need to be converted into higher cognitive one, right? So like this, IgG estimation may not be reliable in diagnosis of neonatal infection, right? Over here, you can see there has to be some comprehension because we are asking for a scientific reason for that. So this is a comprehension or understanding. Last, we go to the MCQ. You can see the binding of antibody to microbial epitope or soluble molecule that inhibit ability of this microbe molecule to bind to host cell surface is termed opsonization, right? We are not checking whether this is right or wrong, but I'm simply uh, giving an example that this is simply a recall phenomena. What is opsonization? This can be converted into like this, or if it is required, you can ask that recall question also, right? But usually what will happen by the time you come down to MCQ, from long question to short note to short answer question to MCQ, you will find that your application part and understanding part is still remaining, and then you need to modify the questions accordingly. When a memory B cell is re-stimulated by its specific antigen, small point mutations that accumulate in DNA, encoding variable regions of both light and heavy chain, may result in antigen stimulated VDJ joining and new antigen specificity, change from production of IgM to IgG, DNA chromosomal rearrangement and altered antigen specificity, generation of antibody with increased binding affinity for its epitope. So correct answer is binding affinity is increased, right? So remember that solving this question needs a great bit of comprehension and understanding. This is not simple recall question. So such type of questions, as I said, it is very difficult to frame such type of questions because it requires a lot of time, right? And there is possibility of making errors in this question, and that is why validation is also very important, right? And the last question, a 40-year-old female presents with butterfly rash over chicks, fever, and arthritis, anti-nuclear antibodies are positive. What is the most likely diagnosis, right? So when you give such type of a clinical presentation, clinical data, investigational data, and then you ask a question, usually such type of questions are being classified into application type of questions, right? So over here, this is systemic lupus erythematosus. So I have said, rather I have exemplified all different type of questions, and I also shown you how to prepare a blueprinting, right? So for that, this is a very important, yes, right? So first of all, this one, the content, type of the question, weightage, core, non-core, and domain. It requires a lot of time, it requires a lot of efforts, and all teachers need to sit together and will have to clarify everything. Once you prepare that for internal examination for general micro and immuno, next you need to prepare for another system, and gradually, I think over a period of a year, you will be able to frame your own blueprinting for your particular subject. It is very easy, but definitely it is going to take a lot of efforts and time, right? So with that, we complete, and the session is now over for discussion, right? I'm unmuting all, right? So those who would like to ask a question, rather would like to discuss, we can have a discussion. And Dr. Kishore.
Good evening, sir.
Good evening, good evening.
Yes, sir. It was a very good presentation, sir. Thank you very much for giving a glimpse of blueprinting.
Thank you very much.
Sir, and one thing I just thought about is we need to know more Excel rather going for before going for the things. See, I see many calculations being done by you.
Yeah,
the formula being done, and then
definitely you need to spend some time in understanding that, right? It is simply formula. So when
yes,
you
sir.
put one particular equation, that will automatically count it and will put it at particular place, right? So
Yeah,
definitely
automatically.
I'll be sharing that Google, Excel with the Google Classroom. You can download and you can utilize that, right?
Yes, sir. One thing, sir, regarding that ideal weightage, you have given some 62 something 62 marks or something like that.
Okay, that is what
What?
I said. Yeah, just a minute. You're talking about this one, right?
Why that 62 marks has come?
It is, if you set a question paper,
Okay.
you will see, this is according to our question paper. Our question paper, in that particular one section, along with option, the total comes 62, right?
Okay.
The student will have to answer only questions of 50 marks, right? But we provide them options. Long question, there is no option, but short note, out of 4, you write
Are
3.
we giving options in this CBME assessment, sir? For the
See, that depends which type of question which you are going to ask and what your university says about that, right? If your questions are from desirable and nice to know area and it carries a lot of weightage, you need to give the option. But once again, this is from our old style, and I'm just showing it how blueprinting can be prepared. But
so, but actually there are some universities which are giving without any options, sir. Students do not
definitely,
have any option.
yes. Then see, over here, your number would come down to 50 only, right? No problem. This will
Yeah.
come to
Okay.
50.
Okay.
So
Okay. Okay.
you simply need to work on that. So out of this is rating, that is 43. This is the distribution, and this is out of 62 distribution. If no
Yes.
option, then you distribute
So
according to
this
50
paper
marks.
is only for 50 marks, 62 marks. Actually, you are giving for 62 marks, but the student should be able to write minimum of 50 marks.
Yes,
Total of 50 marks.
yes. Right.
And the pass mark will be 50%, that is 25 marks.
Yes. Very right.
Okay, okay, sir. Right, thank you, sir.
Oh, welcome. Dr. Fatima?
Hello.
Yes, madam.
Yeah, good evening, sir. Very nice presentation, sir, from your side.
Thank
Hello.
you. Yes, I can hear.
Yeah. So my question is, sir, half of it is answered by you, and the question was from Kishore, sir. Like 62 and in immunology and 60, it is not fixed. It depends upon and varies from university to university.
Not even
Exactly.
university. Sometimes it depends upon the college also, right? You, along with your expert, you can decide.
No, but for summative assessment, final exam, university will decide. No? So distribution of marks.
Very
Internals,
right.
we can do it. Yeah,
Yes.
internals, we can do it based on the
Please,
weightage.
please do it for
Uh,
your internal examination, because summative
yeah,
examination we don't have control, right? It is usually
yeah.
decided by university, but at least you do it for your internal examination. That will give you a great experience, right?
Next thing is about the review of the question paper. So here in India, we don't do it, but abroad there is a review of the paper before administering the paper to the students. So how is it feasible in India, sir? Review of
why
question paper.
why why abroad? See, in my department, we all teachers sit together and we discuss the question paper, right? We discuss the question paper. See, it is a question of integrity that nobody is going to leak it out. So definitely even the person of a junior most post like a tutor, he will be sitting with us and he can also ask a question, sir, this question is not that much clear. Can we modify like that? So once you sit together, then especially for blueprinting, it is very important that you all sit together, right? But for summative examination, definitely there are certain limitations. You can have your confidential friend with whom I always do it. I've got one of a very good friend with me. We sit together in confidential manner. I hand over the question paper to him and he suggests me the changes, right? So there is a question of integrity and trust. You can always do that. It is always, yeah,
So here also we can go for. Okay.
definitely. There is no limitation for that, right?
No, but the thing is, the higher authorities may not agree because they fear of leakage of questions. So for that reason, I was asking. So like,
Yeah, higher authority would not know that, right? Usually it is confidential, but I know my friend who is absolutely not going to leak any question, right?
yeah,
And if we talk about internal examination, nobody is going to ask, right? Nobody is going to question because that is one of the way of pre-validation of question paper or questions. It is very good method.
yeah.
Yes.
Then regarding MCQs, sir, MCQs only 10%, I think. Are we supposed to give from next year onwards? Like we do it for internal this thing assessments and for quiz purpose, but formally we have to
CBM
include for this year, coming year, next year.
20%.
20%, sir.
Yes, it is 20%.
And we can include even the reasoning application questions, understanding and this thing application based on the weightage.
That is suggested by MCI, right? You should check for the comprehension and you should check for the application rather than simple recall. Yes.
Yeah, that's what I was asking. Extended MCQs we can use, I think.
Yes, very right, madam.
Today we
So
have.
can you share the PPT, sir? Because I
Yes,
have
surely.
missed the initial part. If you can share.
PPT along with Excel
Okay, sir,
sheet,
thanks.
I'll be sharing that. Dr. Bedi was saying something. Dr. Bedi?
Yeah.
Today we have Dr. Siraj with us. I request Dr. Siraj to make a comment.
Yeah.
Dr. Siraj, you just unmuted yourself and you are self-muted. He is unmuting. Dr. Kishore.
Yeah, Dr. Kishore already asked a question and Dr. Fatima has already asked a question.
I have asked the question, sir. I finished my question.
Yes.
Yeah.
Okay.
I think Dr. Siraj may not be there.
I think he is offline.
Okay. If he would have been there, it would be great. You could have added to the topic, right?
Yes. Dr. Sarvat Fatima.
Yes,
Yes.
sir. As an exercise, can we prepare some questions and share within the groups or in the Google Sheet? That will be better.
It would be
It will
great.
provide. Yeah, it will help all the members.
In fact, in pathology group, they are making MCQs and case-based questions for every chapter.
Yeah, we can create a question bank in that way, sir, for microbiology too.
Yes.
Definitely we'll create that, right? We'll create, especially MCQ would be too difficult because a long list, but case-based learning, yeah, case-based learning cases can be prepared. That would be great for all of us, linkers. And I'll just share some of the important things, how to prepare this question paper blueprinting. I'll put a folder and I'll put important exercise in that particular group, right? In the Google Classroom.
Thanks a lot.
Surely we'll do that, right? I think no question from any audience, any participant. We can close over here, sir.
Okay.
Okay, sir. So once again, thank you all.
Yes. The second batch for microbiology registrations have started, and it has already crossed about 50 registrations. So, I mean, we are moving ahead, and please inform your friends that the second batch registrations are also there.
Okay.
Sir,
Sure.
is it the last webinar for this batch, sir?
I think it will continue till the end of this month.
Okay, sir. Right. Thank you.
Yes. Dr. Sanjay is the best person to answer, Sanjay and Purnima, but as they decide this.
Yeah, we'll continue till end of the July. We'll complete some of the exercise which is still pending, and objectives still to be completed of some of the systems, right? And some other exercise also we'll put it. We'll continue till July end, sir. Okay. Sir. Okay. Goodbye.